So I realized, having done this a couple times, and um, recorded some videos that I ended up stopping because driving while doing this is not easy. So I get distracted and I can't think, and lots going on. So I decided to, keeping with my theme here of driving me crazy, I decided to still be in a car, while I'm recording, but not drive. So here we go. So right now, today, I'd like to talk a little bit about obsessive-compulsive disorder, or OCD. Now, you hear a lot about OCD in the world, and OCD can kind of be used like kind of colloquially, as well as medically or as a diagnosis. And we'll kind of break that down a little bit. Now, the DSM, kind of some of the DSM criteria of diagnostics of OCD or obsessive-compulsive disorder, it's really marked by obsessive, intrusive thought patterns that elicit intense fear, usually intense fear of like world-ending type fear, life-ending type fear, that's accompanied by compulsive, ritualistic behaviors to kind of manage and deal with it. And those ritualistic behaviors often are very time-consuming and problematic. Like it impacts their life. Now, what I always like to try to do is contextualize this on the spectrum of normalcy. Okay, so feeling anxious or feelings of fear and anxiety often elicit a sense of feeling out of control. It is a sense of chaos. It's very common that when we feel anxious, it's either in response to a feeling of either the thing itself is too much, there's too much going on, too hard to handle, or my capacity is not great enough to handle this thing. And then that makes us feel like we don't have control. So it's normal and appropriate in a sense to try to control chaos with ritualistic behaviors. Here's an example of this. When I'm driving, not driving right now, when I'm driving, I live in America, drive on the right side of the road, and I follow traffic patterns. Those are ritualistic behaviors that try to control chaos. You might have a routine, right? Every morning I wake up and I brush my teeth, or I do these things, and that's a way to kind of control the chaos of the day. Those are not bad things by any means, right? It's good in order to have these ritualistic behaviors. Now, what it becomes problematic is when we start to essentially control things that are out of our control, or control things in response to a feeling that there's no way that we can actually control that feeling. A lot of times, you can think of this in terms of behavior patterns, a feeling and a behavior in response to that feeling. But if we kind of take it looking at it from a little bit deeper level, a lot of the times this is tied to like much deeper kind of identity and existential feelings. Maybe I feel like I'm someone maybe I had a chaotic childhood, and I feel like I equate control with self-worth. And if I can't control these things, I'm not good enough, or I won't be safe, or I won't be loved, right? And that's oftentimes when we see that significant emotional disconnect, as when it's tied to these deeper wounds. Because someone could have a feeling of feeling out of control and have a behavior in response to that, a ritualistic behavior that is not necessarily disordered or doesn't necessarily cause problems. So kind of going back to this spectrum of normalcy, you can see how there's aspects of this can be normal. There's aspects of this that can start to get disordered but wouldn't go all the way to clinical OCD. And then there's obviously the really severe cases, what we call pathology or pathological cases. I think it's interesting to kind of start peeling back these things and start looking at those deeper tendencies. And also, it's interesting to kind of ask ourselves, why is it that when certain times I respond with ritualistic patterns to control chaos, and it's not bad, or it doesn't like lead to disorder in my life. And other times it does, right? So like I was saying before, oftentimes it can be related to a response to these deeper held beliefs, okay? In the context of religion, so I'm Catholic, in the context of Catholicism, a kind of religious-based OCD-like behavior is often called scrupulosity, where you become overly scrupulous about thinking that you have to adhere to religious practices or behaviors in a very specific way, or you're not going to be good enough. You're not going to be loved. You're not going to be seen good in the eyes of God. And that's a very like intense and obviously pretty terrifying feeling, right? So it's interesting that when you start to peel back those things with people who struggle with OCD or even just those kind of OCD tendencies, you often find this deeply held belief that is disordered. And it's often related to something that is not proper to reality, right? And again, I think in mental health, it's interesting that to kind of consider, why is that? Why is it that these deeply held beliefs related to self-worth often lead to mental distress? And these patterns that we can see in some cases can lead to properly ordering one's life, and in other cases leads to complete disarray. And I don't say that to minimize the intensity of these experiences, to say that it's all kind of the same, it's normal. People who struggle with ADC, OCD, these behavior patterns are really, really tough to deal with. But again, it's interesting to kind of see that correlation. Now we're asking ourselves, okay, well, what do I do about it? Okay, well, from a mental health kind of aspect, there's lots of different ideas and thoughts in terms of how we manage OCD. From my perspective, from a medical management side standpoint, we're number one, I guess the way that I see it is the role medications can play is that they can help decrease the intensity of the anxiety, the physiological response, the anxiety response, that amygdala going into fight or flight that's associated with that thought, that intrusive thought. Then there's the behavioral aspect of it, the mental emotional aspect of how am I relating to having these thoughts, and what am I doing because of the thoughts, the ritualist behaviors. And there's different types of therapy that would kind of related to prolonging the behavior, kind of exposing ourselves to thought patterns, and then helping the patient not respond in the ritualistic way, kind of like trying to cut out of that vicious cycle, things like that. Again, there's all these modalities, there's all these different approaches to therapy that can help patients start to identify that and work past that and kind of decrease the negative cycle. A lot of times, a big missing element from my perspective is getting down to those deeper core identity concerns. And especially in today's day and age, where there's a lot of talk about identity, there's a lot of talk about truth and reality, and objective versus subjective, and you have to have a guiding post for patients. You have to have the ability to kind of make objective claims about someone's self-worth. Because if you don't do that, then those core identity, what are you pointing them towards in relation to those core sense of self? So anyways, that's just kind of like a highlight of how someone might start to navigate OCD. And again, just to kind of contextualize some of the OCD tendencies, how they can be seen on a spectrum of normalcy. And then obviously when they get to those severe cases, it's very disruptive. And then again, just kind of like more thinking why is this the case? Why is it that reacting to those beliefs in that way impact me in such a profound way? So those are some thoughts. My name is Jared Crump, and if you are looking for mental health help and you live in the state of Idaho, please find me at sparrowmentalhealth.com. Like and subscribe and all that good stuff.